Okay. Good afternoon, everybody. My name is Angie Harris. I'm the Regional Marketing Manager for Achieve TMS Central, and we're so excited to be here for our grand opening at our Marshalltown Clinic in Marshalltown, Iowa. I'm going to turn it around so you can see everybody in our group. We're joined today by our Achieve TMS Central team and the Marshalltown Chamber of Commerce members. So to get us started, Rebecca Curran.
Hello, I'm Rebecca Curran, and I'm the Regional Operations Manager for Achieve TMS Central. Thank you for being here with us today to celebrate the grand opening of Achieve TMS Central in Marshalltown, Iowa. We're very excited to offer TMS services to the Marshalltown area, and I'd like to thank the Chamber of Commerce for your welcoming support of Achieve into this community. And I'd also like to take a moment to thank Angie Harris for everything she does behind the scenes to put all of this together.
Thank you.
And I'd like to introduce our team here in Marshalltown. So this is our technician, Sienna Wilder. And Sienna's experience in healthcare and her commitment to this community have made her a wonderful asset to our team. Erin Hatcher is our psychiatric mental health nurse practitioner. Erin has been practicing in Marshalltown for over a decade, and her vast knowledge around mental health and this area specifically has been incredibly beneficial, and we really have a fantastic team that's dedicated to excellent patient care.
Wonderful, thank you.
Good afternoon. I'd like to personally thank everyone for attending today and express my dedication to the community of Marshalltown. The mission of all of our professional staff to provide high quality care in a relaxed and comfortable environment. I have practiced in Marshalltown for a number of years, and I'm very excited to be able to move forward using the BrainsWay Deep TMS, which is a non-invasive state-of-the-art treatment for depression, and be able to bring that to our community of Marshalltown.
Wonderful, thank you. All right.
Are you ready for us?
Yeah, excuse me, sorry.
To present this to them.
I'd like to present this plaque. An appreciation for you doing business here in Marshalltown, setting up your business and employing you great folks. It's great to have expanded opportunities in Marshalltown, and we salute exactly what you're doing. So very nice.
Wonderful, thank you.
And also we have a cup here, mug, chamber mug, and it's enclosed. There are several of the Chamber of Commerce ambassadors' business cards.
Wonderful, thank you.
Some opportunities there for some touching base with some folks.
Absolutely.
Very good.
Thank you so much.
Thanks. All
Now
right.
the exciting part.
Yes, the big event.
So I don't know who wants the scissors.
We're gonna have Erin do the scissors.
You guys want to?
You have the camera to take. Can you take a couple pictures? Like still photos from over here, Sienna? Do a little limbo. Yeah, if you could get a couple pictures too, that would be great. Wonderful, thank you. Yay! Wonderful.
Congratulations.
Thank you.
Thank you. Well, thank you for your dedication to the community and for the services that you're providing. Absolutely. We're really excited to be here.
Yes, and the Marshalltown community has been very warm and welcoming and just everything that you would expect from Marshalltown. So we're excited to be here for sure.
Thank you.
You bet, you bet.
And have more people call it home.
Yeah, I bet, yeah. Uh-huh. Yeah. We are going to do a quick little slideshow presentation about what TMS is. You're welcome to stick around if you'd like to, just to learn a little bit more. If you have to scoot, please scoot with a cupcake on your way out. Becca is going to go ahead and do that part of it for us. I'm going to do more of the screen.
That's totally fine.
Okay. All right, go ahead.
All right, so we are Achieve TMS Central.
Showing it very well.
Hello.
Hi there.
You got here just in time.
Welcome.
Yep. We just started our presentation, so feel free to come on in so you can see.
Okay.
Okay, so we're a mission-driven organization dedicated to helping people suffering from major depression and OCD with deep transcranial magnetic stimulation. So we collaborate very closely with community providers, and we're very patient care focused, so we strive to provide outstanding, high-quality care and give hope to our patients. So the prevalence of depression is actually very, very common. 1 out of 6 Americans suffer a major depressive episode in their lifetime. So that's 15 million Americans a year. Of these people, 32% are resistant to any drug therapy. So that's 2% of the adults in the US population in any given year are considered to have treatment-resistant depression. Studies have shown that people who fail to respond to their first line of treatment, medication treatment, that successive medication trials, they're less and less likely to achieve remission with each successive trial. A depressed brain does not function the same as a healthy brain. There's changes in blood flow and metabolism, and definitely neurotransmitters. So major depressive disorder, there's many structures in the brain that have been very, very closely linked to major depression. Of these structures, most of them are hypoactive and some of them can be hyperactive. So this has been identified as the depression circuit. So with TMS for depression, we apply the magnetic stimulation to the left dorsolateral prefrontal cortex. And what this does is it stimulates increased activity and production of neurotransmitters in this area, which then stimulates the whole circuit and then back up the circuit. TMS is not really new technology. Even though it's new around here, it's been around for a while. The deep TMS that we're using was actually invented in 2000 and FDA approved for treatment of depression in 2013. So there's 2 primary types of TMS. There's standard TMS with the figure 8 coil and deep TMS with the H1 coil. And the primary difference is the depth of penetration. So your surface TMS will penetrate 2 to 3 centimeters, and your deep TMS will penetrate 4 to 6 centimeters, which allows us to treat those deeper structures in the brain, which have significantly more connections to the underlying mood circuits. And so the deeper stimulation has been proven to get better treatment results, which is what we see here. So the blue column is your response rate, and the red column is your remission rate, and this is deep TMS compared to surface TMS. So this is a study done in 2019 in Croatia, and it's a study really comparing deep TMS and surface TMS, and there was a group that was just treated with medication. So each of these groups was only treated with deep TMS, only treated with surface TMS, or only treated with medication. And so these are the response rates after 4 weeks of treatment. So the population that was treated with deep TMS had a 72% response rate compared to 44 with the surface TMS and only 26 with medication alone. And then with remission rates, still pretty good. So the H1 coil was 64% remission rate, the figure 8 coil was 43% remission rate, and medication was just a 12.5% remission rate. So we're really seeing some good results. Studies have proven that it's the repetition and the frequency of TMS that really makes it work. So this is just a comparison of deep TMS with 20 sessions, where we're at with the remission and the response, compared to 30 sessions is significantly better. So our treatment regimen, we go for 36 sessions. So we've got the 30 sessions right in a row, and then we do a tapering period for the last 6 sessions. The referral process is super easy. Providers can refer, therapists can refer, people can self-refer. You have to be 18 years of age, and it starts with a free 30-minute informational session, and we kind of go through all of the criteria and the risk factors and screen out anybody that has contraindications. And then we do the psych evaluation for prior authorization, and as soon as we're authorized, the cortical mapping and treatment can begin. So it's really super easy. Like I said, the treatment regimen, we do 30 treatments, 5 days a week over a 6-week period, and then the last 6 treatments we taper over 3 weeks. The treatment itself lasts about 20 minutes, so your entire appointment only lasts 30 minutes. Depending on how chit-chatty you are, sometimes it can be a little longer, and that's okay too. So the side effects, this is what's really amazing about this, is there's no systemic side effects like there are with medications. No adverse effects on cognition, no memory loss. People's primary complaints from treatment, and this is especially towards the beginning of treatment, is neck pain and headache. You can feel the magnetic pulses, but you do get desensitized to it as you get used to it. So, there was no seizures during the clinical studies. There were 6 seizures reported in the post-marketing period. So the risk of seizures is about 0.1%. So that's pretty low. That's lower than even some antidepressants. So this is just the comparison chart of different treatments. So this is TMS, where the side effects are generally headache, neck pain. Antidepressants, there's a lot of systemic side effects all throughout the body. And then with ECTs, obviously there's the memory loss and all the effects from the procedure itself. So relatively simple, no side effects. You can come like on your lunch break and you can go back to work. Like, it does not disrupt your function. You can continue to function. Contraindications, obviously magnetic metal in the head or the neck, other than dental implants. Pacemakers and implantable devices, they have to be enough distance away from the magnetic pulses. We don't want to interfere with those things that need to do their job. A history of seizures or a seizure disorder, and this is reviewed case by case. Some people who have epilepsy still choose to take the risk because, the depression is more debilitating than what they're dealing with their epilepsy. And if it were to induce a seizure, it doesn't induce any ongoing seizures. It would just be from during the stimulation itself. So once you shut it off, it's over. Substance abuse that lowers seizure threshold, or neurological conditions that increase seizure risk. Severe dementia doesn't really have an effect per se on the TMS itself, but just looking at the therapeutic benefit, it can be kind of a scary treatment if you're not really understanding what's going on. And then with pregnancy, really there hasn't been any studies to prove that it is safe with pregnancy, so we just go the safe route. And we work with all the major insurance carriers, and insurance has really been picking up coverage for TMS. This year in Iowa, both of our major Medicaid carriers, Amerigroup and Iowa Total Care, started covering TMS because they are seeing the benefits of it. Yep. So there is a lot of coverage for it. Other potential indications, so TMS is approved to treat OCD. It's now also FDA approved for treating nicotine addiction. They're doing studies, on bipolar depression and opioid addiction. So it is definitely a growing field. So we're just groundbreaking technology. We're a really dedicated team. It doesn't disrupt your lifestyle. We do a lot of communication with the community providers. There's no waiting list. We handle all of the insurance stuff. Our staff is trained, and we're very accommodating to our patients as far as hours and things like that. We just try to make things work. So, absolutely.
Great.
And of course, we enforce all our COVID-19 safety guidelines. This was actually fairly easy for us since this treatment is always one-on-one, so we never have a lot of people in here at one time. So we just schedule a little bit of extra time between treatments for cleaning, and that takes care of it. Yeah, absolutely.
Wonderful, thank you. Does anybody have any questions?
Yes, absolutely.
Are you part of a group, or is this a independent individual office?
So we are part of a group. So we just started in Iowa this year, and we opened our first 2 locations in Ankeny and in Mason City in March. And then we just opened here, and we're going to be opening in Sioux City next month.
Wow.
Yep, and our parent company is actually Achieve TMS East, and they're out in Massachusetts. And they've got 17 sites out there, and they've got 2 in Connecticut. So, yeah.
Mm-hmm.
Cool.
Yeah.
Yeah.
It's really exciting.
Yeah. All right. right, we're gonna move into the treatment area and do just a little demonstration of the machine. You're welcome to come back with us if you'd like. This is what our machine looks like. We have a nice comfy environment in here. While you're getting treatment, you'll have the ability to watch Netflix and whatever program you would like. I'm gonna hand the phone over to Becca. She's going to narrate. I'll get in front of the camera. I'll be the guinea pig patient, and Sienna and Erin are going to demonstrate what it would look like if you were coming to your first appointment, and you'll get to hear and see the machine in action.
Yep. So at your first appointment, everybody gets their own cap, and this cap is not shared with anybody else, and we keep it in its own box. Yep. And with the cap, so each cap, we fit it on the patient's head individually, and then there is a grid that goes on there as well that we line up with specific points on the skull, and then we use those measurements to guide us throughout the mapping process and then for placement for treatment. I'll sneak in a little bit closer here so you can see. This is always my excuse for not spending a lot of time doing my hair. So I'm like, we're just gonna mess it up anyways. Yep, and she gets the cap on nice and snug. And I'll come in here so you can see that there are some colored threads and things to help with our lining up. And then the grid itself. So these are placed on there specifically for the patient. So we line it up with marks, with specific landmarks on the skull so that we are, it's really individualized to everybody's head shape. Perfect. Looks good. Okay. Yep. It dozed off. Yep, tap your blue button. There you go. And it just takes it a second to wake up.
So the first thing that we would do is start, do you want to work on the machine, I'll work on the placement?
Yep. Okay, so for the cortical mapping, the first thing that we're trying to do is, so there's an area of the brain called the homunculus, which is your motor cortex. So it stimulates different parts of your body to get a motor reaction. And what we're specifically looking for is the point where it triggers a reaction in her right thumb. Oh. Yeah. And they've identified this area on the motor strip because of its placement with the depression circuit. So then there's a formula that you use basically where you find the area on them that gives you the best response in the right thumb, and then you move forward from that based on the formula, and then also based on the patient's individual head shape. Yep, so that all comes into play. There you go. Okay. And this part of the demonstration will actually go pretty quick because they're fairly familiar with mapping Angie, and we've been through this a few times. Yep.
Just gracious enough to let us
Yep.
do this to her several times.
Depression prevention.
Exactly.
Right, yeah, no,
Exactly.
she's all charged up for,
That's right.
Yeah.
Well, we're pretty happy people, so.
So this is just the beginning.
Will it charge my iPhone while I'm in there?
No, it sure won't.
One, two.
Yep.
1, 2, 3. I don't know if you can see that finger
I don't know
close
if I can.
enough, but if you can see her hand jerk a little bit, and just,
I say we can give her one more.
I was gonna say, I'll just do it one time with a little bit more, that you can see, but then when you're doing treatment, we do the very lowest, dose that shows any movement.
Yep.
1, 2, 3.
Yep.
So if
Yep.
you can see how our
See a little?
hands move, and then we would just move this up and back, and it tilts side to side to be able to determine where the best isolated movement of her thumb is, and that would give us the right treatment area.
Yep.
And then when you actually do the treatment, we bring the helmet down.
There. Yep. And on the helmet itself, I'm just going to zoom in here, Angie. There's this for guidance to help with your placement. And these guys are pretty familiar with us. So when the initial appointment takes a little bit longer with a new person, but we know where Angie's treatment area is. And we'll just let it run one cycle so you can hear what the machine sounds like. Yep. Sienna's got her all fastened in there.
And I can still like move around if I wanted to and talk, obviously.
Yep. No.
There you go. And that's also, so when you start treatment, you start at a really low dose, and then as you get used to it, as you get acclimated, then the dose of treatment does go up.
Okay. Are you ready, Angie?
Okay.
So this is one cycle.
Yep.
And
And
that's
that's
it.
and that's it.
So it'll
Yep.
run those trains for the entire 20 minutes.
Okay.
And then there'll be a pause in between those trains.
Yep.
But that's kind of it in a nutshell.
Interesting.
Yeah.
Yeah,
Sort of magical, huh?
Absolutely.
cool.
I would say the results are pretty magical.
Yeah.
Yep. So,
Yeah, seeing the change in folks is really, the best part, obviously.
yes. Yep. And that we're treating the actual issue as opposed to the symptoms.
Right.
That's what I love about it. So, yep.
And exciting to have it in Marshalltown, because if you think about somebody previously would have had to drive to Des Moines, Waterloo, Iowa City, 5 days a week. That's a huge burden for somebody who's already struggling, with a pretty debilitating illness. So I'm
Yep.
very excited to be able to do this in Marshalltown and
Cool.
help people locally.
Yeah. The
Absolutely.
need is certainly there and it's ever increasing, so,
Right.
I've known somebody with trichotillomania.
Oh,
Does-
yeah.
Does this help in that area? You can hear from me?
There's a lot of things that TMS is used to, off-label.
Yes.
And oftentimes people can have co-occurring things for example, we were just talking about somebody that might have fibromyalgia. You might experience some relief from some symptoms of other things that are attributed to it. It's not prescribed for that specifically, and the FDA only has it approved for major depression and OCD right now, but that I think is going to quickly expand over the next several years.
By the way,
Yep.
for those of us with OCD, it's really CDO.
Yeah,
Yeah. Yep.
because that makes more sense.
What about Tourette's?
So they're doing a lot of ongoing studies, and honestly, like in Europe, they're using it for a lot of off-label things. Well, they're not really off-label there. They're actually treating a lot of things, including things like Tourette's, limb dysfunction after a stroke, things like that. So there's really a wide variety of things that they're treating with it there. But here in the United States, we stay pretty on-label. And honestly, most people go with treatment that their insurance pays for, so that's where we really focus.
Does it stimulate the brain to produce more serotonin?
Yes, it stimulates the brain to produce more neurotransmitters. Yep.
So if I was private pay, what would a treatment process cost the person?
The entire package is close to $10,000.
Okay.
Yep.
If you just paid for it.
If you just paid cash for it, yep. Yep.
You get those.
Yep. Yeah.
So you wait FDA approval to be able to get insurance coverage or?
Yep.
Medicare, Medicaid?
Yep,
all that
yep.
kind of stuff?
Well, and honestly, you get FDA approval first, and then the insurance companies kind of pick it up slowly. So, but pretty much all the major carriers are now covering it for depression. They're still working on OCD. There's a lot of them that are not covering it for OCD yet. So, but
I think the majority of time people want a private pay is because the insurance restrictions, insurance requires you to have 2, 3, 4 medication failures within your current episode, and some people are like, I'm just done with medications, and if they're blessed enough to be able to pay out of pocket, that's certainly an option.
Yep.
Cool.
So you have one machine in this location then?
Yep, just one machine, one person at a time.
I'm assuming that machine's probably worth a lot of money.
Yes. Yep, it is.
That's why it's $10,000 for a full treatment.
Yep.
I'll say the technology that BrainsWay uses is the only patented technology for deep TMS. So there are different types of machines that do a surface TMS, but deep TMS only comes from this machine.
Yep.
So
And
how
then,
are we getting the word out besides having different meetings?
well, we've been doing a lot of different approaches, obviously reaching out to providers in the area. We're also advertising on social media. Angie does a lot of marketing, just community outreach. Education is a big factor. Education really, I think, is the primary thing. Once people know what it is and how it works.
Are you
Yeah.
in town?
No, I'm in Des Moines.
In Des Moines? Our Kiwanis Club, I'm looking for a program for January.
Oh, yeah.
Yes, let me know. We'll
Give me
swap
your card,
cards
so I
for
can-
sure. Yeah. It's been interesting. COVID has obviously made it difficult.
Beautiful thing is we're virtual.
Yeah.
Oh, that's
I do
perfect.
Zoom.
Yeah,
Zoom
perfect.
meetings.
There's times where I'm knocking on doors and handing out flyers, and there's other times where I'm like,
Yeah.
I'm just trying to get people virtually as much as possible. So it helps that we have a nice group of women who know people around here. So spreading the word that way has been very helpful too.
Okay. Well, give me your card before.
Yes.
Absolutely.
All right. Okay, I'm going to wrap up our Facebook Live event, unless anybody wants to say anything else on Facebook. Thank you, everybody, for coming. We really appreciate all the support. Like I said, Marshalltown has been nothing but warm and welcoming, and we're just so excited to have the ability to be welcomed into this community and be able to continue treating folks around here. So thanks again, and I hope you all have a great night and stay safe.